I'm Dr. Grace Tan. I'm a general surgeon and a surgical oncologist. I specialize in surgical oncology, which is another word for cancer surgery. I see patients mostly with gastrointestinal cancers like the stomach cancers, colon cancers, as well as something called sarcomas and also melanomas.
Today's topic is on colorectal cancer. There's been a growing trend lately. More and more younger adults are being diagnosed with colorectal cancer. So, what are your thoughts on that?
As a physician myself, have been seeing more and more patients or younger patients come to seek advice with regards to colon symptoms. And then also patients who have had been diagnosed with colon cancer. I guess in most people's minds, cancer is something which happens to older people. And colon cancer, especially, a lot of people would have come across a relative or a friend that has colon cancer. It's quite common, one of the top cancers in Singapore. But generally, it does occur in people, older than 60 or 70. But in the recent years, yeah, we've definitely seen patients who are younger, in their 40s, 50s, who are getting colon cancer. You may have heard of, in a sense, the most famous case, the Black Panther star, Chadwick Boseman. He was only 39 actually when he first discovered he had colon cancer. He had treatment for that, and then unfortunately, I think a few years after his initial treatment, he had a recurrence or relapse and then eventually passed away when he was 43. So that's really, quite young to be getting this cancer.
Yeah, and I think a lot of people were also sad and shocked when they heard the news that he passed away. So, which leads me to the next question. Why do you think young people are getting cancer nowadays?
Well, I think there's many factors which increases the risk of colon cancer, especially in the young. Probably, to do with a combination of like lifestyle, maybe stress, environmental factors like being exposed to certain radiation, carcinogens in the environment, as well as our dietary habits. I think it's really difficult to avoid, eating processed foods because it's everywhere. So I think it's a combination of factors. The other reason maybe also because we're a bit more vigilant and we're a bit more aware of medical conditions in general, and maybe younger patients are also going for health screening and for checkups. People are actually also increasingly aware of certain symptoms, which may increase the chance of them going to the doctor and being checked up at an earlier stage.
1 in 20 people in Singapore are likely to be diagnosed with colorectal cancer. And also, according to World Health Organization, it's the third most common cancer in the world. So, with all these cases happening, and also with the rise of AI, what are your thoughts on colorectal cancer screening with AI?
I think that definitely AI is coming into our lives in all forms. And in medicine, AI is also playing a very big part. So, with regards to AI in colon cancer and screening, I would say that I think there are definitely some users and some benefits. Just taking a step backwards, when we talk about colorectal cancer screening, what we usually recommend would be for patients between the ages of 45 and above to consider going for a colonoscopy. So, a colonoscopy is a procedure where you have a small sort of a tube-like instrument with a camera at the end. It goes through the back passage and goes into the large intestine to look for cancer. And actually, what's more important is looking for precancerous growths called polyps. And during the scope itself, we can actually remove the polyp and then prevent the growth from becoming cancer. So that's what colon cancer screening is all about. Now with AI, there have been some companies that have come in to integrate AI into this colonoscopy to increase the chances of picking up these polyps. So I think that in general, I feel that it does add some benefit and maybe does increase the pickup of polyps to a certain extent.
There's another treatment called immunotherapy. Is that a gold standard for treatment?
So it's a good point because immunotherapy is another sort of big term that everybody hears when they talk about cancer treatment. And immunotherapy is a kind of therapy that enhances your own body's immune system to fight the cancer. So with colon cancer, immunotherapy is usually not used in the first line treatment, means they're not used initially, but it's used usually for patients with advanced cancers. And it's also used in a group of patients that have a specific mutation called MSI high cancers that benefit from immunotherapy. If not, it's not used for all patients, but it has changed the landscape of cancer treatment, especially for the advanced colon cancer patient.
You talk about AI and immunotherapy. Are there any new innovative surgical techniques on the horizon?
In the field of cancer and in medical treatment, we're always getting advances. So I think with regards to colon cancer treatment, in surgical techniques, we have keyhole procedures, we have robotic surgery that is picking up. In terms of advanced colorectal cancers, we now have many surgical techniques which can improve the outcomes of patients who go for surgery for metastatic disease from colon cancers. If there's a metastasis or spread of the colon cancer to, for example, the liver, then the liver surgeons can do an operation to remove those parts. But if the cancer spreads to an area called the peritoneum, I actually specialize in a procedure called cytoreductive surgery and HIPEC, which we combine surgery together with intraperitoneal heated chemotherapy in order to target the peritoneal disease. And that has also increased our survival for advanced colon cancer patients. The last, I think, sort of innovation and something which is still gaining popularity and is getting more and more adapted is something called PIPAC, which is PIPAC, which stands for pressurized intraperitoneal chemotherapy, which also is used for treatment of peritoneal disease.
Can you tell us more about this high pack and pie pack?
Both techniques utilizes a form of intraperitoneal chemotherapy. So the peritoneum is a lining of your entire abdomen. So sometimes I would describe it to some patients. It's like a plastic bag within your tummy, and within that plastic bag is all your internal organs like your stomach, your colon, the ovaries, and the uterus. And around all these organs would be this lining called the peritoneum. And unfortunately, some patients with colorectal cancer, when it becomes advanced, they do have spread of the colon cancer to this lining. So in the past, we would consider that stage 4, and the patients are either given just best supportive care or palliative care, and they are told that they are not curable. But with advances, we've now realized that in certain patients, even though they do have advanced cancer and stage 4 cancer, we can sometimes do something about it with the intraperitoneal chemotherapy. So with HIPEC is a heated intraperitoneal chemotherapy. We heat it up and deliver the chemotherapy after surgery. And that increases the survival rates and also reduces the chance of the cancer coming back. PIPEC, which is the pressurized intraperitoneal chemotherapy, usually this method of delivering the chemotherapy is reserved for a bit more advanced patients who are not suitable for surgery. But what it does is that it controls the peritoneal disease and hopefully prevents, complications from the peritoneal disease.
Thanks for explaining the difference between high pack and pie pack. One is heated, one is pressurized. Right, so we have talked about the trends, we talked about the various treatments available. What is life like after cancer remission?
Like I mentioned earlier, I think that the reason why cancer doctors, do what we do is, of course, to cure the patients, and of course, we want the patients to lead meaningful lives after that. In general, the timeline for cure is usually 5 years, meaning that after 5 years after the patient completes treatment and it's been 5 years, then we are all very happy, we celebrate, and we sort of deem that the patient has been cured. But after that 5 years, what happens to the patients? I think is very dependent on the attitude that the patient has towards life in general, whether they continue to live a meaningful life, whether they have supportive families and social circles around them, and of course, the other things like continue to eat healthy, to be active, and to be as productive in their lives as possible. And then, of course, the other thing that they always have to consider is, what to do in terms of their health. Continue to, avoid unhealthy habits like smoking, excessive alcohol intake, and of course, continue to go for regular health checkups. Specifically for colorectal cancer, most of the time I would recommend my patients to consider repeating blood tests as well as a colonoscopy to check for new colon cancers, because their risk of developing another colon cancer is slightly higher, to repeat that colonoscopy, every 3 to 5 years.
Anything that they need to take note of when they are in remission?
Most patients, I guess after having undergone some kind of colon cancer treatment, would be quite attuned to the symptoms of colon cancer. So the same things, if there's any change in their bowel habits, if they have any blood in the stool, if they're feeling unwell, they're not gaining weight, they have any bloatedness, these would be signs that are worrying and they should seek medical care and attention soon. Other things are things like if they are losing appetite, not gaining weight, then also may be a sign that they need to have medical attention.
So for
Yeah.
all these patients, right, after their whole treatment, is there really a way to stay cancer free?
That's a really good question. I think that, a lot of it, I guess, is in how the patient adapts to the changes, the support system that they have around them, with regards to family, social circles, diet, and lifestyle. So, in terms of things that we can do, I would say that most patients, if they can, should, continue to be active, do some exercise, that will definitely reduce their risk of recurrence. I think eating a very healthy diet with lots of greens, vegetables, fruits, a more plant-based diet. Evidence has shown that, it does improve outcomes after cancer treatment. And then, of course, avoiding the vices like smoking, alcohol, or in moderation at least for alcohol, may help to reduce the risk of recurrence as well.
So basically, you just have to lead a very healthy life, right? No smoking, just eat healthy and exercise.
Yeah, I think
Yeah,
activity is very important,
yeah.
and maintaining your relationships with your friends and family, keeping your mind active, your body active. It's all part and parcel of the
Mm.
recovery process.
Thank you very much, Dr. Grace. To all the listeners, if you have any health related questions, find us on our Instagram and ask your questions there. See you next time on Ask Farah.